Creatine versus protein. Which is better for muscle recovery and energy? Creatine enhances energy and performance during high-intensity exercise, while protein supports muscle growth, repair, and development. Combining both may improve workout results and recovery. Which is better for workout performance? Creatine can help boost performance during high-intensity exercises, such as sprinting, weightlifting, and high-intensity interval training. It will help you recover in between sets and can reduce workout fatigue. However, adequate protein is necessary for anyone who engages in exercise. While protein does not provide immediate energy, it enables muscles to recover, repair, and grow after exercise. Combining the two will give you the best results. You may experience improved endurance, increased strength, and enhanced muscle mass, while also aiding in the recovery of damaged muscle fibers. Creatine versus protein. Main differences. Creatine is a naturally occurring compound formed from the amino acids arginine, glycine, and methionine. The body can make creatine from amino acids, and it can absorb creatine from certain foods. On the other hand, protein is a nutrient that is composed of amino acids and provides calories. Protein can be found in every cell in the human body, which is why it is known as a building block of life. A comparison of creatine versus protein. Protein primary role providing energy for the muscles necessary for proper muscle growth and development and tissue repair. Helps repair muscles after exercise, best for boosting performance during high-intensity exercise, supporting recovery and muscle growth after exercise. How it works: increases phosphocreatine, which provides phosphate to adenosine triphosphate ATP. ATP is used for energy during high-intensity exercise. Point 3 supplies amino acids for tissue repair, muscle building, and other body functions. Sources found in animal foods, e.g., meats, poultry, and supplements found in both animal and plant-based foods, e.g., beans. Protein powders. Creatine benefits. The benefits of creatine include: can increase and maintain muscle mass during strength training. One meta-analysis found that creatine increased lean muscle mass in 64% of studies analyzed. Faster recovery after intense exercise. One study showed that creatine supplementation can reduce soreness, muscle damage, and inflammation post-exercise. Improve performance with high-intensity exercise. Studies have shown that creatine can improve sprinting time and enhance agility and jumping performance. Increase strength. One meta-analysis has shown that creatine supplementation can increase bench press strength by approximately 5%. Some people may not respond to creatine supplementation. This may be because some athletes have higher baseline levels of creatine in their muscles. Creatine sources. Creatine can be found in the following foods and supplements: beef, chicken, fish, pork, supplemental powder or pills. The body produces about 1 gram of creatine per day. Supplementing with creatine can increase the amount of creatine stored in muscles. Protein benefits. Protein is essential for many bodily processes. Protein provides the following benefits: limits muscle loss. Protein can help reduce muscle mass loss associated with aging, weight loss, and deconditioning. Supports muscle growth. When used during strength training, protein can increase strength and muscle mass. Aids recovery. Post-workout, protein can decrease symptoms of muscle damage. Protein with carbohydrates can replenish glycogen stores. Weight maintenance. Protein can help you feel full and can decrease ghrelin, the hunger hormone. This can help reduce your appetite and aid in weight loss or weight maintenance. Protein sources. Protein is found in a variety of plant and animal sources. Complete proteins contain all 9 essential amino acids and are typically derived from animal sources, but also from whole food sources like soy, such as tofu and edamame. Most plant sources of protein are incomplete, so a wide variety of these is needed each day to get all of the essential amino acids. Food sources of protein include beans, beef, chicken, eggs or egg whites, fish, lamb, milk, pork, protein powder, shrimp, tofu, turkey, Precautions and side effects. The International Society of Sports Nutrition regard creatine as safe for most healthy individuals. Common side effects associated with creatine use include gastrointestinal upset, bloating, cramping, diarrhea, and nausea may occur. This is more likely to occur if you take large doses. Water retention and weight gain. This is usually temporary and is more likely to occur if using loading doses of creatine. Muscle cramping. Insufficient hydration during intense exercise can lead to dehydration and muscle cramps. It is essential to stay well hydrated while exercising and using creatine. Protein is an essential part of a healthy diet. However, consuming too much protein through diet or supplementation long-term can lead to complications, including gastrointestinal upset, including nausea, diarrhea, or constipation. Kidney stones. Increased risk of kidney damage. Higher risk of heart disease of consuming high-protein foods high in saturated fat. How long does it take for berberine to lower your blood sugar? The blood sugar-lowering effects of berberine were mainly observed over a 3-month period in most studies. However, how quickly it works can vary depending on factors such as age, dosage, and whether you're also using anti-diabetic medications. Time it takes to lower your blood sugar levels. A study in people with diabetes showed that the consumption of 1 gram g of berberine per day for 3 months reduced blood sugar levels by 20%. In another 3-month trial looking at people with type 2 diabetes, the blood sugar-lowering effect of berberine was similar to that of glucophage metformin, a medication used to manage type 2 diabetes. While a reduction in blood sugar was observed in 3 months, study periods from other trials ranged anywhere from 14 days to 6 months. Research suggests that the blood sugar-lowering effect of berberine lasted about 3 months. 1. The blood sugar-lowering effect of berberine became remarkable with treatment duration over 3 months. 3. What is berberine? Berberine is a compound extracted from plants, such as the Oregon grape, barberry, and golden seal. 8. Research has shown that berberine improves blood sugar control and cholesterol. How does berberine work? Berberine lowers blood sugar levels by decreasing sugar production in the liver. Various signaling pathways and enzymes that are responsible for releasing stored sugar from the liver into the bloodstream are blocked by berberine. Decreasing insulin resistance. To make the cells more sensitive to insulin, berberine increased the number of insulin receptors available. Increasing insulin secretion. Berberine promoted insulin secretion in a dose-dependent manner. This means that berberine only triggers a release of insulin when sugar is present. Inhibiting several key enzymes. When the activity of an enzyme that is responsible for breaking down sugars in the gut is blocked by berberine, the intestinal absorption of sugar is also blocked. Increasing sugar uptake. Berberine increased sugar uptake by the fat, muscle, and liver cells even in the absence of insulin. Factors that contribute to the blood sugar-lowering effect of berberine. The following factors impact the blood sugar-lowering effect of berberine. Age. Research supports the use of berberine therapy in older people with diabetes. However, some studies suggest that the effects of berberine on blood sugar levels became unremarkable in people aged more than 60 years. Further studies looking at the effect of age on the berberine blood sugar-lowering effect are needed to clarify the results. Daily dosage. The dosage of berberine ranges from 0.4 g per day to 1.5 g per day. However, the effects of berberine on blood sugar levels were unremarkable with a daily dosage of more than 2 g per day. Concurrent use of anti-diabetic drugs. The efficacy of berberine combined with other medications that lower blood sugar levels was better than either berberine or the anti-diabetic drug alone. Treatment duration. While one review indicated that the therapeutic effect of berberine became remarkable with treatment duration over 3 months, another review suggested that such effect became unremarkable as the treatment lasted more than 90 days. Tips for managing blood sugar levels. Some of the tips for managing blood sugar include avoiding smoking. Smoking increases heart and blood vessel problems. Even if you do not smoke, avoid being around secondhand smoke. Eating whole foods. Focus on a diet rich in vegetables, fruits, whole grains, beans, nuts, and lean proteins. Drink plenty of water and limit sugary foods and drinks and highly processed foods. Moving more. Not only does exercise prevent and help manage type 2 diabetes, it also improves your energy and mood. Watching weight. Maintain a healthy weight to prevent or manage diabetes.